both of them are on. Down there, okay. Hi everyone, I'm Dr. Rich Castellano, the Smile Doctor. We're here today with Maggie for a 1-week follow-up. Thank you for letting us share your follow-up, and we're going to get the little stitches out from the eye. So 1 week from the lift, how was your recovery?
It was pretty easy. I hardly used any pain pills.
Okay, very good.
The swelling went down really fast.
Yep. Still with a little bit of swelling at 1 week, but without the bruising, we're almost ready for the grocery store test. Are you happy with what you see under here?
I love it. I just love it.
So proud of you. And we also did the upper and the lower eyelids, and she had a little cholesterol deposit, the xanthelasma, so we trimmed some of that as well. So we're going to get those stitches out. Caitlin, can you come a little close? And if you look on this side, turn your head towards me, you see this is the tragus and how all the swelling's doing fine. And these are the little dot stitches that we're going to remove in just a moment. She's a little puppy, and that's going to settle a little bruising, a little swelling. Now turn your head this way. So this side, there's a little more delay of healing, which is normal to have one side that heals a little more quickly than the other. So, but it's just looking so good, so proud of the results. Now, to look at her before pictures, we're just so proud of, see all the excess skin, and she had that xanthelasma here. We were able to clear that out of there, and then the upper eyes as well. But looking at her neck and jawline, she's so much more defined now. So, comments from family or friends?
You look 10 years younger. Oh, you look so good.
Very good. And, you know, we talked about it before that, you know, Maggie is a smoker, and she smokes about a half pack a day, so patients can still heal well. The less we smoke, the better for healing. That's why patients choose these types of treatments, because they're safer, it's easier for the healing, and, you know, people don't want general anesthesia, they don't want a full facelift. So for this part, Caitlin, if you can come in a little close, and what I'm going to do, these are the stitches. Let me have you rest your head all the way back. There's a little tiny knot on each side, and there's a little bit of swelling. So what I do is if I just grab one little knot here, and then once I grab that little knot, and I trim, very fine little, might feel a little bitty pinch. Okay, so that one will pinch there. So then I grab this one here. Now open your eyes and look all the way up for me. There you go. And then there's one right over here. So now that I've trimmed those 1, 2, 3 knots, so this stitch is out, and when I take the stitch out, it flattens just a little bit because the stitch pulls that up some. So as I was telling Maggie, no rub and scrub on the skin. We want to be very delicate and pat with mild soap and water. You might feel a little pinch. You can close your eyes for me. You might feel a little pinching there, and then that's gonna almost done with this one. That's a longer stitch. Okay, little pinch, and then that one's totally out. So we want to avoid raising your eyebrows up real high like this or anything that will stretch. So avoid stretching out. For those of you just joining, we're using our VersaFlow 3M units. This is a HEPA filter to protect our patients and to protect our team. So same thing on this side. I'm just going to grab the little internal knot. This is a running subcuticular suture. Our Blepharoplasty, I leave the muscle, I leave the fat, because you don't want to prematurely hollow the area. So you can fill hollows with filler and volume, but when you take the excess skin in the right patient, it's a perfect way. And there's the little stitch. It's just, you know, that one little, it's one stitch that goes all the way across.
Carmen asked, where is our location?
We're in Tampa and in the Villages, Florida, so I'll go a little more slowly here. Look us up at ImageLift.com. You can download our books on Amazon. We guarantee we can make you look younger. So there's in the Smile prescription, there's the stitch. So all your stitches are out. So normally I would do a 1 month follow-up. If you need us before then, you let me know. But you look so good. You did a great job with the wound care. Now she was talking about a couple of things. She said she's a little puffy here. She's got the bruise. Now that's going to settle. That's a festoon. And a week after you might see a little puffiness, but that's going to settle. Also, the less we smoke, you'll see less of the festoon, so do the best you can there. And she said her vision was a little blurry. So with the ointment, when you put ointment on the eyelid incisions, it will create some blurriness, whether it's the lacquer lube or some of the Vaseline. You can wash that out with refresh tears or the saline for the eyes, and that doesn't stay. It's really just the Vaseline. But what I've also noticed is, now gently close your eyes and keep them closed. She's got really good closure all the way across. You don't want to take too much skin where it's tough to close the eye. I won't let that happen, but you've got great closure. The blurriness should settle. You didn't take much of the pain medicine, so now you ease into your activities. We got to listen to our body. What other questions can I answer, Maggie?
I can't think of anything.
Okay, so proud. If you're just joining, I got to show her pictures one more time and just brag on her. How good Maggie looks. We got to trim the excess eyelid skin. Let me see if I've got her profile view here as well. You can see on her profile here what a difference. If you can catch from this side, her profile here, and she's got so much of a stronger jawline. Now at 1 month, that's when we're going to take her pictures, and then we'll compare the before and afters, because after we do a cosmetic treatment, our vision gets better and our memory gets worse. So we always need the pictures. Congratulations, Maggie. So proud of you. If Maggie, we still give hugs here. We get air hugs.
Air hugs.
The heart, we do the elbows and the heels. We'll give you guys a hug too. Thank you for watching. We got more videos coming soon. I'm Dr. Rich Castellano in the Villages, Tampa, Florida. We're using the VersaFlow 3M HEPA filter system, so that way we can protect our patients, protect our team. We'll see you later.